Here's coronavirus is well and truly in retreat. The R number we keep talking about, remember, that represents how many people one infected person is likely to go on to infect. Well, that remained below 1 all across the UK. The number of tests coming back positive in Scotland yesterday stood at 4.6%. And important to remember again, anything below 5%, and the World Health Organization considers an outbreak to be under control. Then there's the latest data from the Office for National Statistics. Now, it randomly samples the population, so its findings are regarded by scientists as some of the best indicators of infection levels. And the figures are moving pretty swiftly in the right direction there too. As of last week in Northern Ireland, an estimated 1 in every 105 people had the virus. In England, that figure was slightly lower. It was 1 in 115. In Wales, it was just 1 in every 125 people. But the lowest of all was here in Scotland, where just 1 in 180 people were estimated to have coronavirus at the end of last week. That works out at 24,300 people infected in Scotland. It sounds a lot, but it is low by recent standards. However, given the virus's transmissibility, scientists do remain fairly cautious about easing restrictions. This is what Professor Linda Bauld from Edinburgh University had to say.
So I guess a public health point I would emphasise is this virus has not gone away. It is still in the community and we must maintain the public health measures we've all been used to living with. But it's undoubtedly the case from this really robust survey that's a random sample of the population that we're making good progress.
So, good progress, says Linda Bauld, but caution needed. And that begins tomorrow in Scotland with the start of a phased return to schools for younger pupils. It's going to include preschool children, pupils in primaries 1, 2 and 3, and a very limited number of secondary students who need to carry out practical assignments. The Scottish Government has made getting pupils back into classrooms their #1 priority. And they say they've been guided, in part at least, by science, suggesting primary school children are not big spreaders of coronavirus. But is that still the case? Well, Scotland's Education Secretary John Swinney will be here shortly to talk about schools reopening. But first, let's hear from Dr. Deepti Gurdasani, an expert in epidemiology from Queen Mary University of London. Good morning to you, Dr. Gurdasani.
Good morning.
So, is it safe then to send Scottish pupils back to school tomorrow, albeit in limited numbers?
I think the way that we are bringing students back to school, so without any additional mitigations in place, is really concerning. I mean, we're seeing, for example, in England that even with 1 in 5 children in primaries, primary care age group children have the highest prevalence across all age groups. We're still seeing a significant number of outbreaks in primary school settings and in preschool settings. So given all of that, it's wrong that primary schools don't really contribute significantly to transmission. Even our own data from the Office of National Statistics show that primary school children in England were more likely than adults, 2 times more likely to be the first case in a household, and once infected were 2 times more likely to infect their contacts. So we need to really take this seriously and put in measures in place in primary schools in line with CDC guidance and in line with what other European countries have done.
All right, I mean, that will be concerning to a lot of parents. Professor Jason Leach, the National Clinical Director here in Scotland, wrote to parents just last week saying younger children are less likely to get or pass on the virus. So he's wrong then, you think, is he?
Yes, I mean, there's a lot of misinformation around this, and a lot of it is based on interpretation of flawed studies, which have only included symptom-based testing for children. We know that children are more likely to be asymptomatic. So if you only test them when they're symptomatic, you're going to miss a lot of transmission that's happening. Studies that are less biased, like the Office for National Statistics survey, which, as you mentioned, is a random survey of the population, really captures this transmission and shows us that there's significant transmission happening that we are not picking up with these studies.
Right, when is it safe then to send children back to school? You were talking in your first answer about mitigation measures in place. What do you mean by that?
So, I mean, mask use, including in primary schools in children 6 and above, like has been implemented in France and Spain. More attention to ventilation. I mean, this is predominantly an aerosol transmitted virus. We give a lot of attention to hygiene, but very little to things like air filtration, purification devices in our schools, as well as carbon dioxide monitors to look whether we have sufficient ventilation. We need smaller class sizes, smaller bubble sizes. The Department for Education has absolutely no cap on bubble size at the moment, and many schools have hundreds of students in bubbles. We need to ensure that teachers, for example, are not moving between bubbles because they can form transmission links between.
You're talking, and certainly in ventilation, about big infrastructure changes here. This is something we want to happen very, very quickly. Also, you're talking about ventilation. I guess the most basic way of doing that is opening windows. That's not a great idea in Scotland in February, is it?
Yes, I mean, I understand the difficulties with opening windows given it's winter, and, you know, opening windows is very good in terms of increasing ventilation. But I think, you know, using air purification devices, air filtration devices can have huge impacts on reducing aerosol and transmission. And we need to do that. Other countries like Germany and parts of the US have put these in place. And I don't understand why we're not paying attention to these really important interventions. And I understand that this requires a level of investment and time, but we've been asking for this for the last year, and this hasn't been done. So there was sufficient time to put this in place.
Here's the problem, though. For every eminent scientist like you coming out with an argument like this, there's an equally eminent scientific voice saying something completely different. There's a range of different opinions now from the science, as it's been referred to. Who should Nicola Sturgeon, who should John Swinney be listening to at the moment?
I think they should listen to people talking about real world evidence around us. I mean, if primary school children don't transmit, then why is the prevalence rate highest in primary schools compared to other age groups? Why have declines in primary school children been slower, even while attendance has been only 1 in 5? You know, compared to secondary schools where 5% of children are attending right now. Why is it that we are still seeing outbreaks based on Public Health England surveillance in primary schools and preschool settings? Why is it that there are studies on these settings that have shown that even preschool closures and primary school closures have a huge impact on R? Why is it that SAGE has recently released a model that shows that even if we open just primary schools at this point in time, R will almost in all circumstances rise above 1, leading to surges in cases? That's the evidence we should be looking at.
All right, Dr. Deepti Gurdasani, many thanks indeed for your insight and analysis this morning. So, a tentative easing of the lockdown begins tomorrow in Scotland as some mostly younger pupils head back to school. Then, from the beginning of March, face-to-face visits to care homes can finally resume. Well, Scotland's Education Secretary and Deputy First Minister John Swinney is here. Good morning to you, Mr. Swinney.